When you're stressed, you're releasing so many more stress hormones like cortisone and adrenaline, puts up your blood pressure, the cortisone puts on weight, damages your immunity. And also when you're putting on weight or your cortisol levels are high, your sugar levels are high. So it's very bad for diabetics to be stressed. When you're stressed, you're less inclined to follow lifestyle habits.
Welcome to the Eat, Live and Move podcast by Miyagi, a space where we bring you the latest science-backed conversations, expert insights, and practical tips relating to all things health and wellness. Hello, I'm your personal habit change expert, Dr. Gina Cleo.
Hi, I'm Dr. Ross Walker, a cardiologist and preventative health expert.
And together with our 60 plus years of collective experience, we're on a mission to help you to improve your health and transform your habits so that you can eat, live, and move better one episode at a time without the fluff or the fads. Now, hello everyone, and welcome back to part 2 of our 2-part series on type 2 diabetes. So many twos in one sentence. Last week, we covered part 1 of our diabetes mini-series where we talked about type 2 diabetes in so much detail. We talked about what it is, what causes it, what are some of the risk factors, as well as the symptoms and how it's actually diagnosed. We also talked about the epidemic diabesity, which is this dangerous combination of obesity and diabetes. Today, we want to focus on some of the fun, juicy stuff around managing this condition, taking a closer look at medications, what are the different types from tablets to injecting insulin. We also want to talk about the importance of lifestyle management for this condition and what you can do to lower your medications or even put type 2 diabetes into remission. Can you even do that? We will find out today. And then finally, and most importantly, if you are pre-diabetic now, how you can prevent getting type 2 diabetes altogether. Woo, Ross,
Yep.
This is some powerful stuff in today's episode. I really want to start by, asking you the question around, say somebody has been diagnosed with type 2 diabetes.
Yep.
What things can they do in terms of their lifestyle management to get on top of it straight away?
Sure. Well, firstly, we make the point there's no cure for type 2 diabetes. In fact, there's probably no cure for any modern illnesses. But with our modern medicine and especially with lifestyle changes, we can manage the condition and certainly put the condition into remission. But I don't think anyone should ever think they're going to be cured completely from the condition. So effectively managing diabetes is the best way to prevent all the complications, because by itself, diabetes just pushes up your blood sugar level. But it's the knock-on effects of all of that that's the big problem. And the better you manage your diabetes, the better you manage your life, the less chance you have of having the serious consequences of diabetes. So first thing is getting the right support from all your doctors involved, the general practitioner, the endocrinologist, and also seeing a high-quality dietitian and a diabetes educator. You want a team. Like anything in life, you need a team to support you. So this disease requires ongoing monitoring of blood sugar level and on monitoring of a whole lot of other health things as well. And so it's getting the right support is absolutely vital. So firstly, let's start with healthy eating. I wrote a book 20 years ago called Diets Don't Work, because you go on a diet like you go on a holiday. What happens when you go on a holiday? You come home. So
come back.
I much prefer to talk about healthy eating. So getting support from a diabetes educator and a dietitian as well, I believe is vital to help manage your diet or your eating habits. But the key things are just sensible eating, following a balanced diet. And I say all the time, less than 10% of people have 2 or 3 pieces of fruit per day, 3 to 5 servings of vegetables a day. Less than 10% of people. And those who do, whether they're diabetic or not, have the lowest rates of heart disease and cancer in the community. And it's just
wow,
a simple piece of advice.
Something.
Yeah. And things on top of that like whole grains, lean proteins, healthy fats, and limit your intake of refined carbohydrates, what I call white death, sugar, white bread, pasta, potatoes, rice. I'm not saying don't eat it. I'm just saying limit your intake of these sort of things. And also a lot of people forget about the fact that many people get their sugars from artificially or sugar-sweetened drinks. So we've got to try and minimize our intake of those fizzy drinks, apart from kombucha, which are really not good for us. And there's certain people where half of their sugar intake comes from those sort of drinks. Also,
wow,
I say to people, really, if you want to lose weight, cut back calories, cut back refined carbs, and cut back grog. Because a lot of people don't realize that alcohol is another source of empty calories and a lot of sugar as well. So one or two glasses most days of the week probably won't hurt most people, but just to go over that on a regular basis, that's another big issue. So the key things as far as diet goes, and going with that, as I said, managing weight.
Yeah, I love that, Ross. I remember when I was working as a dietitian in my clinic, I'd often see people who ate fairly well, but they were drinking quite a bit. And I would just say to them, if we just cut out the alcohol and you kept your diet exactly the same, you will find significant changes in your weight. And that is what would happen every time. But not only that, they would sleep better. And then that in turn helped their overall well-being, their recovery, all sorts of things. So
can I tell you, this is an anecdote, not a clinical trial, but I saw a woman in her 70s who had quite significant abdominal obesity. And I was having the conversation with her about good health. And I said, and you've got to really try to reduce that waist circumference of yours. And she and her husband sat there and said, she doesn't eat much. But then she went on to tell me she drinks a bottle of wine a day. That's 1,000 calories before you put anything in your mouth. That's ridiculous.
Wow, yeah. Yep. It's so common because we don't even think about those calories. You know, it's a drink, but it is so common. So really great note. The other thing with managing our weight and also our physical health is regular physical activity. We know the guidelines say to aim for at least 150 minutes of moderate intensity aerobic exercise every week. So that could be something like taking a brisk walk, swimming, cycling, dancing, but really you just want to do anything that you find joy in doing. There's absolutely no point in trying cycling, for example, if you hate getting on a bike. Yep. The best exercise, Ross and I always say this, is not walking. It's the one that you'll consistently do. So find something that you enjoy. Could be walking.
Could be walking.
That's right.
But whatever it is, I mean, I have my own gym at home, so I don't go to gyms. But I mean, gyms are great for some people. People like the collegiate atmosphere of a gym. I just prefer to do it at home.
Yeah.
I'm an exercise bike person. So
Same.
I played soccer and squash till I was 52 and I damaged my knee, which was replaced 4 years ago. But over the past 15 years, I do a half an hour most days on my exercise bike. I've broken 3 exercise bikes from overuse in 15 years. And I do 15 minutes of weights and stretching every day. So I think exercise should be 2/3 cardio, 1/3 resistance training. But as you so rightly say, the best form of exercise is one you'll keep doing.
Yeah, absolutely. I love that. And then the other thing I think we should mention is stress management, which often isn't something that we think of when we're talking about trying to prevent diseases or manage diseases, but is so important. Practicing stress reduction techniques, things like deep breathing, meditation, yoga, or mindfulness can really help to manage stress levels, which then helps to, what does it actually do, Ross? Tell me from like a physiological level.
Yeah, from a physiological level, there are 2 aspects to this. Ooh. Number one, when you're stressed, you're releasing so many more stress hormones like cortisone and adrenaline, puts up your blood pressure, the cortisone puts on weight, damages your immunity. So that's one of the bad things. And also when you're putting on weight or your cortisol levels are high, your sugar levels are high. So it's very bad for diabetics to be stressed. But secondly, when you're stressed, you're less inclined to follow lifestyle habits.
Yes.
So people don't have the same motivation when they're feeling stressed, a bit depressed or anxious to eat better, to do their exercise, to sleep, and they don't sleep well. So all the things we talk about the whole time about good health, those 5 keys of good health, no addictions, good sleep, good eating and less of it, second best drug on the planet, 3 to 5 hours of exercise, and most importantly, happiness, stress management. You're not going to do that if you're feeling stressed. So we have to bring in these stress management techniques. And I see stress a bit like a garbage bin. You fill the garbage bin up, you've got to empty it regularly. Otherwise, all the rubbish starts to spill over the sides. And you empty it regularly by things like deep breathing, meditation, yoga, mindfulness, all the things you've said, and do things that you enjoy doing. One thing you can't measure in your bloodstream, Gina, is a thing called pleasure. And it's vital to have pleasure in life and do things that you enjoy doing.
Yeah, I so agree. And, the other thing is that we tend to fall back onto our unwanted habits or our bad habits the more stressed we are, because we're seeking pleasure. We want that hit of dopamine, and that's going to come in forms of sugar, phone scrolling, alcohol, smoking. So the more relaxed we can be, in an enjoyable way, and that can also be doing things like hobbies, spending time with loved ones, listening to music, the more likely we are, as you say, Ross, to really follow through with those healthy habits that we want in our life. So I love that. I've tried to meditate. I'm a terrible meditator, but I have found that doing breath work is something that I can do and do it quite effectively because it's dynamic. So my mind is still is thinking about the breathing, whereas meditation, oh, look, my mind goes everywhere. And I know that's, the point is to bring it back, but I find breath work a lot more effective for me.
Again, it gets back to what you said about exercise. Whatever stress management technique works for you is the best stress management technique for you. I've been meditating every day for the last 30 years, and so I'm pretty good at it, and I like doing it, but I incorporate a bit of breath work into that as well. Mm-hmm. So I think that's really, really important. And moving on to the next bit, which is stopping smoking. You see, we talk about diabetics as being the canaries in the coal mine. Now, in the old days, they used to put canaries in the coal mine. So if there was a gas leak, the canaries would die before the workers over and would clear out. And diabetics are really, they just get all the diseases that the rest of us get. They just get it so much earlier. So please, if anyone's listening to this who is still smoking, whether you're a diabetic, the best thing you can do for your health is to stop smoking, because this basically accelerates the devastation of diabetes. And please, it's very hard to give up smoking by yourself. Find a good healthcare professional, ring the quit line, whatever, all these smoking cessation programs. I don't care how you do it, you just have to do it. And last but not least is regular monitoring and taking your medications. Now, again, in my own practice, and I've been doing this for well over 45 years as a doctor now, is the 80-10-10 rule. 80% how well you look after yourself, 10% the right sort of medications, 10% the right sort of evidence-based supplements. And the people who follow that 80-10-10 rule the best, the people who are the best at their lifestyle, take the prescribed medications, take the prescribed supplements, they just become long-term mates of mine. Nothing ever happens to them. It's the people who can't or won't. And here's one of the problems here. You line up 100 people, give them any medications at all or any supplements. After 12 months, 50% of people aren't taking the medications or the supplements how you've advised them to take. 50%.
Wow.
So,
really? What do you think some of the barriers are to that? That blows my mind.
People say, I was getting side effects, so I didn't feel. They didn't even tell the doctor. They just said, I'll stop it because I wasn't feeling so well. Or it was a bit expensive, or I ran out and I forgot to. There's always some nonsense excuse. But when I say to my patients, I've started you on this medication today. These are the potential side effects. If you're having side effects or problems, you must call me. I want to know that something I've done to you has caused you harm. Equally, I want to know that it's working. So let me know what's going on, because that's good motivation for them to keep staying well. And it's really important because you think about being a diabetic, having to prick your fingers all the time, getting your sugar levels. We now have a thing called the Libre Freestyle Glucose Monitor that you can just stick under your arm for a couple of weeks. It's a bit expensive, but it is covered, especially for type 1 diabetes. For people who need insulin or are insulin dependent, the Libre Freestyle Monitor is covered by the PBS scheme. But for people who aren't, unfortunately, they still have to pay. It's about $90 a fortnight. So it's pretty expensive to use it. But, gee, I'll tell you what, if you can afford it, better than pricking your fingers all the time. But also, looking at be mindful of the food that you're eating. Keep some sort of track of your food intake, how much activity you do. There's a lot of simple apps you can get now that will tell you. You can just record what food you're taking, and you can record what sort of activity you do. And also, there are very good apps now for medication adherence and other factors that may affect your blood sugar control. And here's another thing. The 80-10-10 rule is so important, but going to see your doctors regularly. And I have some people, I say, I'd like to see you in 2 years for another check of your heart, and they don't bother coming back. They come back 8-9 years later. By this stage, they've wiped out half their heart without knowing it. And it's so much harder to rebuild that heart damage. So please realise that and as I think I've shown you my cup that I drink out of, my tea out of at work, that says, please do not confuse Google search with my medical degree. Realise that the reason we have doctors, the reason we have expert dietitians, the reason we have people like yourself, experts in habit change, is because we are experts. We understand the topic better than you do. And so to have that guidance, to have the team approach, is much better for you.
Love that. You've made me realize I'm such a stickler for the rules, because when a doctor has given me a medication, I have followed the protocol to a T. I remember even recently calling my GP and being like, hey, I don't think I need this one anymore. What do you think? Before even thinking of getting off it. Like, the thought of just getting off it for me is like, oh no, I'd never do that. But it's obviously just a personality thing. Now, Ross, this is a really great segue into the discussion around medication, because we know that there's a lot of different types of medications out there to manage diabetes. So can you just give us some basic guide on the different types of meds to manage diabetes, and I guess when they're needed?
Yeah, well, really for type 2 diabetes, we'll get onto insulin a bit later, but for type 2 diabetes, the workhorse drug is a drug called metformin. And it's really the first drug I prescribe for any of my type 2 diabetic patients. And in fact, it's being trialled around the world now in a thing called the TAME study as an anti-aging drug, because here's the interesting thing about metformin. They gave it to a bunch of diabetics, type 2 diabetics. It's not for type 1 diabetes, just purely for type 2. And they found, compared to age-matched controls and weight controls who weren't diabetics, that the diabetics on metformin had less heart disease and cancer than people who weren't diabetic.
Wow. What?
Yeah, it's it comes from a group of drugs known as biguanides. The name doesn't really matter. And basically, it works by decreasing the glucose production in the liver, but also, most importantly, in my view, improving insulin sensitivity so your sugar can get into the workhorse cells like the liver and the muscle where we need the sugar to do its job. So that's what metformin does. But this is the problem. I line up 100 people, give them any pill at all, including metformin, 90 think you're a genius, and 10 want to throw it at you. So there's about a 10% side effect rate for all medications. The classic ones with metformin that can really upset your gut. Okay. Some people get really bad diarrhea, vomit, nausea, and there's a condition called lactic acidosis that it can bring out, especially if you've got impaired kidney function. So sort of thing where you shouldn't borrow your neighbour's metformin.
Okay, good to know. All right, what else have we got other than metformin?
Well, there's a group of drugs called sulfonylureas. Most people who are diabetic would have heard of a drug called diamycrone, glipizide, all of those sort of drugs. And these drugs are used, basically they stimulate insulin release from the pancreas. They give you a bit more insulin and they help to lower blood sugar. So they're quite effective drugs. But again, in some people, it can drop the sugar too much. It's pretty unusual to get hypoglycemia as a type 2 diabetic, but it certainly can happen. And they're very commonly used as well. There's another group of drugs called DPP-4 inhibitors, and they work by inhibiting structurally DPP-4, which is an enzyme that increases this enzyme stimulates insulin and reduces release of glucagon. So that's all. It's medical mumbo jumbo. But what I'm saying here, there's things called sitagliptin, saxagliptin, linagliptin, and all these drugs.
It's different language.
Yeah, it's reasonable treatments for people with type 2 diabetes, and people would know these as commonly used drug as Januvia, or combined with metformin. You can put the two drugs together, Janumet. Now, moving on, this is now the blockbuster discussion. This is talking about the GLP-1 receptor agonist. Now, why is it a blockbuster? Because we're talking about Ozempic here.
Oh,
So,
I knew you'd be saying that. You love Ozempic.
well, no, that's not true. I'm just saying it is a blockbuster drug because these GLP-1 receptor agonists have multiple effects. They affect your appetite, so you don't feel like eating as much. And they also markedly increase insulin release from the pancreas, slow down digestion a bit so you have more time to break the food down. And the typical one is Ozempic, but there's another one, Saxenda. They're real names, not the trade names are exenatide, liraglutide, dulaglutide, Ozempic semaglutide, lexenatide. And interestingly, a couple of weeks ago in the New England Journal of Medicine, there was a study on lexenatide showing that it improved Parkinson's disease for all things. Wow. So not only do they get the diabetes benefits, because there is a bit of a link between diabetes and Parkinson's disease, lexenatide was good for that. And a lot of the studies done now on Ozempic, mainly published in the New England Journal of Medicine, have shown, firstly, an incredible benefit for diabetes and cardiovascular disease. So you get two bangs for your buck, better management of diabetes, but also lower risk of cardiovascular disease. But also, one of the big things now is they gave it to a bunch of non-diabetics, published in the New England Journal of Medicine again, and there was about an average 15-kilo weight loss in people who are overweight with Ozempic. Wow. So there's a lot of things that are very good with Ozempic there. But again, side effects. What are the side effects with the GLP-1 receptor agonist? Well, the side effects, the big side effects, the GI, gastrointestinal gain. So we're talking about nausea, we're talking about nausea, vomiting, diarrhea. These things can certainly happen. And we're not saying these drugs are completely benign. There's a very rare risk for thyroid cancer. Okay. So if someone's got a strong family history of thyroid cancer, I would probably not go near these drugs. Occasionally, they can really inflame the pancreas, and they do slow down gastric emptying. So there's been some studies suggesting that people who are on Ozempic, if they're going to have an operation, they probably shouldn't have Ozempic for at least 10 days before the procedure so that they make sure there's no food in their stomach when they have the anaesthetic. So, and then finally, there's the final group of drugs I just wanted to mention were called SGLT2 inhibitors. SGLT2 inhibitors are oral drugs, the gliflozin drugs, so empagliflozin, dapagliflozin. And these drugs work by getting the sugar out through the kidneys. And so people have quite a significant diuresis, get a lot of sugar down in the bladder, the genitourinary region. So there can be a side effect of genitourinary infections. But these are, again, blockbuster drugs for diabetes because, again, gave it to a bunch of diabetics and reduced their risk for heart failure 30%. So we gave it to a bunch of non-diabetics and it did exactly the same thing. So, again, very, very good drugs.
Yeah. Now, Ross, I know that there's been a huge shortage worldwide of drugs like Ozempic and Saxenda. Do you know what the status is with that?
Oh, yeah. The status is, the reason there was such a shortage is because they couldn't get the cartridges. So with Ozempic, it's really easy to inject yourself with these things because they're made in these cartridges. They just couldn't keep up with the demand, so they couldn't make the cartridges for Ozempic. But it waxes and wanes. Sometimes it's pretty easy to get. Sometimes it's harder to get.
Okay, so would you say that you just go back to your doctor, and if that's the drug that the doctor's recommended for you, eventually you will find it somewhere? Or because I know a few months ago it was like, look, don't even try. That's not going to be an option for quite some time.
Yeah. No, but I think just recently there's a reasonable supply there. And a lot of the diabetics said, well, hang on a minute. This is for diabetes. All these people are overweight and using our Ozempic. But really, when you think about diabetes, we mentioned on the last podcast that it is insulin resistance. Now, 30% of Caucasians, 50% of Asians, and 100% of people with darker or olive skin have that gene for insulin resistance. So really, it's a gradation from being a bit overweight to pre-diabetic to diabetic. So when can it be justified? People should be starting these things. It's a difficult argument.
It's true. It's almost an ethical question because, prevention is also so important. Ross, can you tell us a bit about insulin?
Again, insulin's been around for about a century. And before insulin was discovered, the type 1 diabetics would die very quickly from a thing called diabetic ketoacidosis. And so, again, here's a misconception people have. When they start needing insulin, we used to call them insulin-dependent diabetics and non-insulin-dependent diabetics. But the reality is there's type 1 diabetes where your pancreas fails straight away, you need insulin. Type 2 diabetes when you're insulin resistant. Those type 2 diabetics may become insulin requiring. They don't go from being a type 2 to a type 1. They're always a type 2. They now just need insulin. Mm-hmm. So we bring in insulin immediately for people who are type 1 diabetics, because otherwise they'll go into diabetic ketoacidosis. But with type 2 diabetes, if we can't control their blood sugar level by all the other means, then we will start insulin. And there are varying types of insulin. In the old days, we used to use porcine insulin, but now we've moved in the last couple of decades to human insulin, which is much less antigenic, so it causes much less allergic problems, much more effective. And insulin comes in immediate acting, medium acting, and long acting. And so basically, people can stylize their insulin management based on the monitoring of their sugars. And this is where every person who's on insulin, in my view, should be under the care of an endocrinologist who's an expert in glandular issues, and also a diabetic manager, and also be seeing a dietitian as well, because you want to make sure that your sugar level is as exquisitely controlled as possible. Now, the problem with insulin is that it drops your blood sugar level in some cases, and hypoglycemia, where the sugar goes right down, can send you certainly delirious, into a coma, and even kill you. So you really need to have this managed exquisitely. And we're talking about things like insulin pumps that can be used, and we're getting to the point of insulin transplantation or pancreatic transplantation, beta cell or islet cell transplantation. There's a whole lot of exciting things happening. And interestingly, 2 labs, one in South Korea, one in North Carolina, have developed a graphene patch that you just put on your arm. It measures your blood sugar level in real time, delivers insulin, and speaks to your mobile phone. So
that's blowing my mind. That's amazing.
Also, recently, the University of Sydney, in conjunction with the University of Norway, have developed an oral insulin that's in this nano capsule that passes through the stomach, gets absorbed into the portal circulation to the liver and the pancreas, and works like a pancreatic insulin would work. And so this only drops your sugar when your sugar is high. So there's no hypoglycemia. It's the sort of thing where a diabetic can just swallow this insulin 3 or 4 times a day, like they'd have a meal. Yeah. And it's not going to cause them any side effects. And it works much more like your pancreas working, rather than injecting yourself in the belly or in your leg. It's got to circulate all the way through the body to effects. So
that is incredible. Oh my gosh. Both my grandparents.
But we're getting to the point where the management of even type 1 diabetes will be all non-invasive, just pills.
Wow.
Pills and medicine.
That's fascinating. I love that there's so much research in this. I was saying that both my grandparents had type 2 diabetes. We're brown skin, so we've got the gene. And I remember their legs and their stomach always being bruised with all the needles that they'd had to give themselves with the insulin. It was multiple times a day, every single day. And it was hard to find a spot that just didn't hurt because there were so many injections. And I'm sure back in the day, they would have had different needles to they do now, which are a bit kinder and slightly smaller. Yeah. But the science and the evolution in the diabetes space is phenomenal by the sound of it. And I'm really excited. So good. Now, Ross, okay, we've talked about management, we've talked about medications. What happens if diabetes is left untreated? Let's say someone's diagnosed and they just choose not to manage their lifestyle or take medications. What do we expect would happen?
Okay, well, we've got to divide this into 2 categories. There's macrovascular disease and microvascular disease. So macrovascular disease, which is things like your cholesterol's too high, your blood pressure's too high, you're smoking. So all the risk factors for cardiovascular disease anyhow are just made so much worse in diabetics. And they tend to, if they've got poorly controlled cholesterol, high blood pressure, they're smoking, then they get heart attacks, stroke, sudden death, peripheral vascular disease. The arteries in their legs get blocked. But then there's microvascular disease, which is the small blood vessels supplying the nerves. So they get peripheral neuropathy where they lose the feeling. They often get very painful neuropathies, as well as a thing called diabetic amyotrophy where they suddenly get pain, say, down their leg, because the femoral nerve, the blood vessels in the femoral nerve get blocked. They maybe get double vision because one of the nerves supplying the eye movements gets a little blockage in the vasa nervorum. Then there's damage to the kidneys, the small vessels in the kidneys, and also damage to the eyes. We all know about diabetic eye disease. A lot of different levels, especially the retina, the back of the eye, can be damaged in diabetes. So many things can go wrong there. But a lot of people don't realise this as well, that there are other complications with diabetics. Now, we all know that diabetics are very prone to things like leg ulcers, which can get infected. They can get gangrene, get all of these sort of problems. So it's important that a diabetic sees a podiatrist and has their feet management exquisite. A lot of skin complications, they don't heal as well as other people. And a lot of people don't know that diabetics get problems with their hearing.
Really? I didn't know that either.
No, they can get significant problems because they damage the nerves. Little blood vessels damage the nerves for hearing. But here's something people don't realise. The diabetics are at much greater risk for obesity-related cancers. So type 2 diabetics, so all the things like breast cancer, prostate cancer, colon cancer, even lung cancer and melanoma, all of the pancreatic cancer, all of these things are related to obesity and type 2 diabetes. Fatty liver, gout, for women, polycystic ovaries. There's a lot of different complications of diabetes. Here's the big thing. We're now calling Alzheimer's disease in many cases type 3 diabetes, because if the diabetics survive their vascular disease, they have a much higher rate of Alzheimer's disease as they get older.
Wow.
And also it can change the brain chemicals, and also it's difficult being a diabetic. So there's a fair bit of mental health issues going with it. There's a lot of depression in people with diabetes.
It sounds like, when you say diabetes, we think of it as just one disease. But when you look at the implications of it, it's really touching on every other organ or every other, our senses, it's our brain, it's so many things, from our skin to our hearing to our eyesight. And there's so many things that are impacted by this one disease, aren't they? That's just, it's huge. It's a hugely impactful thing. So of course, there's a higher, rate of depression, anxiety in people who, are diagnosed with type 2 diabetes.
This is why we call them the canaries in the coal mine, because they
Makes
just get
sense.
so much earlier than other people.
Poor canaries. That's a tough time. That's why we want to prevent it as much as possible.
It was
obviously.
a bad gig, that job for the canaries, I can tell you.
I know, the worst ever. You couldn't pay canary enough. Now, Ross, at the beginning of this episode, you mentioned something around, not being able to say that we can cure diabetes, but we do say that we can put diabetes or type 2 diabetes into remission. And I think there can be a bit of confusion around this terminology. Can you just make it really clear for us what is actually possible, what is not? What does remission mean? And can we actually reverse type 2 diabetes?
Well, we do know beyond a doubt that the vast majority of type 2 diabetics are carrying more weight than they need to. But it's a bit of a vicious circle. The more insulin resistant you are, the easier it is to put on weight. And then as you put on weight, the more insulin resistant you become, and you put on more weight, and then you get more insulin. Your sugar goes up, 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 up. So if you can break that cycle by reducing your waist circumference, so for men, you want to get it well below 95 centimetres. For women, well below 80 centimetres. Sorry, ladies, I don't make the rules. And if you can get it down below that and really be not rigid, but pretty good with your eating habits and your exercise, and also take the medications you're on, you may then become pre-diabetic, in some cases even non-diabetic, but you still have the gene for insulin resistance. And any stressor, which includes the stress of weight gain or emotional stress that puts up your cortisol levels, as I mentioned before, can push you back towards diabetes.
Okay, that makes a lot of sense. I think I may have mentioned in the last episode, but I worked with Dr. Michael Mosley and a whole team of people on an SBS documentary called The Australian Health Revolution. And it was about this idea that we can reverse type 2 diabetes. And we did. We did in a few people, and it was amazing. And they did all the things that, you and I have been speaking about in this podcast, things like managing their diet, their calorie intake, exercising more, managing stress, really like basic things, not easy to change, but certainly anybody can do it. And those people were able to go into type 2 diabetes remission and really change their life, which was incredible. I want to touch on the idea of prevention, because not everybody listening to this podcast is going to have type 2 diabetes, but I can certainly vouch that everybody would want to prevent having type 2 diabetes. Now, there are some things we can't control, like you've mentioned age, genetics, ethnicity, but there are many things that we can control. And is it fair to say that, managing type 2 diabetes, the things that we need to do that we talked about, those lifestyle factors, would be similar to the things that we might need to do to prevent it? So things like having a healthy, balanced diet, managing our weight, being physically active, limiting how much sedentary time we have, quitting smoking and alcohol, having regular checkups, managing stress, sleeping well, etc. Is there anything outside of that you would say we should do to prevent type 2 diabetes, or are those really just the basic foundations?
That's really the basic foundation. The other thing I would suggest on top of all this is that there's a supplement. It's a bergamot supplement known as BJE 100. And I believe everyone over the age of 50 should take it twice a day for the rest of their lives. I've been on it for 15 years. Okay. And that also is, we've published data on this in the Journal of Clinical Lipidology a few years back, showing that it has a significant reduction in blood sugar level as well. And I've had a number of people who I put onto this supplement, and their diabetic control has become so much better. And some people have gone from diabetes to pre-diabetes, no diabetes. So that would be the only thing. I mean, but what you said is 80% of the management of diabetes, 80% of the management of everything else. So I'm just talking about the 10% being supplements.
Interesting. Is there a specific brand that you would recommend or not recommend?
Not allowed to do that on a podcast, I'm afraid.
Oh, you can't. Okay, you'll have to send me a text message later.
Yeah, just Google BJE 100.
Okay, all right.
That will give you the brand.
All right, beautiful. That's really helpful to know. Thanks, Ross. Now, let's say that someone is listening to this episode who is, let's say, pre-diabetic or even has type 2 diabetes now, and they feel like they need more support. Before you talked about this multidisciplinary approach with having a diabetes educator, dietitian, an endocrinologist, a doctor. What should someone do if they're feeling like they need more than they've got right now?
Well, if they've done all of those things, they have seen their GP, their endocrinologist, and they're still educator, dietitian, they still feel they're struggling. You can also seek private services. So, for example, at my Miyagi, we also offer a program called Diabetes Wellness Australia. I'm the Chief Medical Officer of that. So I oversee the educational webinars and the delivery of the program. So when people get involved, they get one-on-one support from an accredited practicing dietitian, advice on dietary management, how to manage the condition, also help lose weight without following the crazy restrictive diets that so many people are pushing these days. And it's personalised to that person's own issues, their own lifestyle and their preferences, all the things we were talking about, best forms of exercise, one you'll keep doing. Recipes, meal plans, live events from me, from you, and our chief behavioural scientist, and also the transformation coach, Kate Gregg, and cooking classes, book clubs, you name it, basically. There's a lot of value in it. So our programs help thousands of people lose weight, control their diabetes, come off insulin in some cases. Mm-hmm. Don't want anyone to think who's listening to this that if you get involved in anything that you're going to be able to stop insulin or stop your medication. So a lot of people come to see me and they think, it's a choice here. I'd prefer just to do lifestyle and not take the other stuff. Unfortunately, sometimes medications are necessary and are part of your long-term diabetic management. Occasionally people can come off medications, but it's more the norm that you do the lifestyle and the medications and the supplements make your condition better. They make the control and management of your condition so much better.
Beautiful. Ross, thank you so much for all that information. There's so much that we've covered in the last 2 episodes, but really it sounds like the key message to take home is that you are in control of your health, even if you're at a higher risk of diabetes based on your genetics, your age, your ethnicity. You can still make some really powerful changes to your lifestyle to put your diabetes in remission or to prevent it altogether. And of course, as you mentioned, support is key. So changing habits takes time, we know that, and support makes that process twice as effective. So having someone to support you along the way is really helpful. Now, let's finish off this episode with a member question for the week. Ross, did you want to read that out for us?
Yes. Well, a member question, this is an interesting one, is for you, Gina.
Okay.
It's from Maya. I think it's Maya pronounced. So, Dr. Gina, I've heard you talk about the benefits of ice baths, and I really want to get into them. Well, it's easy, you just get in, but I just can't seem to get to do it myself. Any advice would be greatly appreciated. But you go in first.
Ross, have you ever tried to go into an ice bath?
No, and I won't.
Why won't you?
It's too cold.
So it's not that easy then, is it? No. I think Maya's question is very valid. Yes, there are benefits to ice baths. The idea is to really get as uncomfortably cold as you feel safe to do. And I completely understand where you're coming from. You know, ice baths can be quite challenging, both mentally and physically. And while they do offer several benefits like reducing inflammation, enhancing your immune system, all the way to increasing your metabolism and boosting dopamine, they're definitely not everybody's cup of tea. They sound like they're absolutely not Ross's cup of tea. So Maya, if you're finding it difficult to motivate yourself to try ice baths, perhaps you could just try a 10-second shower or even contrast showers. So I love doing contrast showers. I'll just have like a nice warm shower like I normally do. Then I turn the nozzle to cold and I might do that for 10 seconds. Then I'll switch it back and switch it back to cold again. And then I always end on the cold. But remember, consistency is the key. So whatever method you choose, really sticking with it and giving it, that's what's going to give it that fair chance for you to see results. There's no point trying to do something if you're just feeling miserable about it. Ice baths are also one of those things where you just want to think less and just do, just like Ross said, just dip your toe in it. But really, you don't want to talk yourself out of it if it's safe for you to do so, because your brain will always say, why are you doing this? This is a terrible idea. This is wildly uncomfortable. And it is uncomfortable. And I guess that's the whole point of it. So I just start small.
Can I just make a point on just generally talking about cold water swimming?
Yeah.
Studies in people who can swim in water below 20 degrees Celsius have shown an incredible benefit for the immune system. And in fact, it's probably one of the best treatments for long COVID. So on a serious note, people who can do cold water swimming, and I'm probably not one of them, I'm a bit of a wuss as far as that goes, really do get an incredible benefit from doing so.
Yeah, it has incredible benefits. Yeah, absolutely. Ross, I think you can do it. Next time I see you, I'm going to splash you with some ice water and show you that you don't shrivel and die. You'll be absolutely fine. Well, that brings us to the end of this week's episode on Eat, Live and Move with Miyagi. And this is actually our very last episode of the season. This is our season 1 finale. We've got some exciting projects in the works at Miyagi. So we're going to be taking a short hiatus to focus on these projects, and we will be back soon. We just want to thank you so much for tuning in each week. We have loved bringing you these sessions, and we hope that you've taken a lot out of these episodes. Well, that's all from us. Thank you again, and we'll be back soon for season 2. Bye, everyone.
Bye.